Hi there, and welcome to this quick orientation to the Health Risk Screening Tool, also known as the HRST. I'm Johnathon Crumley, Chief Operations Officer and one of our person-centered thinking trainers here at IntellectAbility. Let's start with why this tool is important. We know that our quality of life is directly tied to our health. Unfortunately, people with disabilities often experience lower health outcomes, not because of a lack of care, but because health issues are undetected, misunderstood, or innocently overlooked. And if someone does not communicate using words, their behavior might be their only way of saying something's wrong. When this occurs, there is a tendency to treat the behavior instead of the real issue or root cause. That's where the HRST comes in. So, what is the HRST? It's a web-based screening tool designed to catch early signs of health risk, especially for people with intellectual and developmental disabilities, physical disabilities, brain injuries, the aging population, children, or other at-risk groups. The goal of the HRST is to detect risk and signs of worsening health issues early so that preventative action can be taken to improve quality of life and prevent unnecessary suffering and death. The HRST was first created in 1992 by Karen Green McGowan, a registered nurse with decades of experience supporting both adults and children with intellectual and developmental disabilities. Her vision was simple but powerful: to give families and support staff, many of whom aren't clinically trained, the tools they need to recognize early signs of health risk. The HRST has been extensively field tested, deemed valid and reliable, and has transformed the way we support people. Karen's legacy continues to guide and inspire our work today. How does it work? The HRST was built to be simple and easy to use. It includes 22 rating items that help identify where someone might be facing health risks or showing signs of instability. Once each item is scored, the tool generates action steps for the support team. These are things they can do to help reduce or even eliminate those risks. Here are the 22 rating items found in the HRST. They are divided into 5 categories: functional status, behavior, physiological, safety, and frequency of services. Each of the 22 rating items are deliberately chosen to make up the HRST. These are areas where health risk and instability are likely to occur in at-risk populations. The HRST assigns a score to each rating item that reflects the level of health risk that has been detected. Each item is scored from 0 to 4. The higher the score, the higher the risk. Let's take a look at how one arrives at a score using the HRST. As shown here, each individual rating item is assigned a numeric score. To arrive at a score, a trained rater must answer yes or no questions about the item in relation to the person being screened. As these questions are answered, the application will rule out scores that don't apply. When all questions have been answered for a rating item, a final score will be assigned for that rating item. Once all rating items have been scored, those individual scores come together to determine an overall score, which is called the healthcare level. The HRST healthcare level is very important. It plots the person on a spectrum of risk that can range from a level 1 to a level 6. As you can see, levels 1 and 2 are low risk. Levels 3 and 4 are moderate risk. Levels 5 and 6 are high risk. Increasing healthcare levels of any degree should always be of concern and promote immediate action. As you will see later, these healthcare levels can tell us a lot about mortality and the odds of dying. Why do these scores matter? HRST rating item scores matter because the actions taken based on these scores prevent unnecessary suffering and save lives. Consider this. What if we could not only prevent an unnecessary death due to a bowel impaction, but prevent the suffering of having a bowel impaction by avoiding this condition to begin with? I need to stress here that the HRST is different than other systems you may already utilize. It's not an electronic health record system used to just collect and store health information about the person. The HRST helps you utilize all the health information you may already be collecting to identify and quantify health risk. As you know, we typically do not suffer from a lack of information. In fact, we often are overwhelmed with information about the person. The question is, how do we filter through all this information to find out what is important to that person's health and safety? This is where our attention should be placed. By answering the yes or no question for each of the rating items, the HRST begins to organize and align all that information. The information is aligned into categories we spoke about earlier: functional, behavior, physiological, safety, and frequency of services. By means of the screening process, the HRST has taken information that may have once been overwhelming and confusing and assigned a weighted score, allowing attention to be placed specifically on the items that pose the greatest risk to the person. Scores tell you where risk has been found and to what degree, but we still need to know how to respond to these risks. It is for this reason the HRST produces both the service and training considerations, which are centered around the person's unique risk and offer actions to take regarding the risk that has been identified. Service considerations suggest the professionals, assessments, or follow-ups needed to lessen or eliminate these risks. Training considerations highlight the areas that supporters and family members should be trained on to better support the person. It's not a one-size-fits-all health risk mitigation approach. This is a person-centered approach. The screening results and responses are unique to the person. Two people may obtain the same score, but for completely different reasons. Who benefits from this tool? The person's unique risk level should be known and appreciated by everyone who gives support. The goal is unified awareness and unified action. Everyone on the person's support team benefits from the HRST. Case managers gain a clearer view of overall health and risk to inform oversight and monitoring. Nurses gain insight into clinical needs and training opportunities, as well as ensure the person is receiving the most appropriate clinical attention, both in amount and intensity. Direct support staff and families gain essential guidance on how to respond to specific health concerns while offering hands-on, regular care, as well as how to have more meaningful conversations with community doctors and clinicians. Doctors and community providers can also use the HRST's information as a quick, meaningful snapshot of a person's health to inform treatment responses. The HRST addresses Medicaid services mandates. The HRST also helps make Medicaid services more accessible, cost-effective, and equitable. Healthcare levels can be used to determine service levels and establish tiered payment rates. The higher the healthcare level, the higher the tier. They also help to inform relative priority on waiting list, allowing those with a higher healthcare level to move to the top of the list. The HRST also promotes safe transitions to home and community-based services by identifying healthcare supports needed to be successful in the community. Perhaps most importantly, it helps prevent critical incidents by identifying individual health risk and providing action steps for mitigating risk before a critical incident occurs. Now, why does early action matter so much? In multiple studies, the HRST healthcare level has been proven to be a reliable indicator and predictor of mortality. In short, as healthcare levels rise, the odds of dying increase as well. This makes early detection and response absolutely critical. Consider this one graph taken from a published independent study of the HRST with regards to mortality. Note the 6-point healthcare level at the bottom. With every 1-point increase in the HRST healthcare level, the person's odds of dying increase. Even a 1-point increase in the healthcare level is significant and should trigger a response from supporters. Let me share with you some best practices regarding the HRST. HRST screenings should be updated at least once a year or anytime something significant changes, like a hospitalization, ER visit, or injury. Think of it as an annual checkup. While the overall screening can take anywhere from 45 to 60 minutes, updates may only take a few minutes, and they are vitally important to document. Only trained raters can complete or update an HRST screening. Use all available resources for information: medical records, family input, support staff, and when possible, the person themselves. Bring a copy of the HRST screening to healthcare provider appointments. It helps clinicians understand where the person's risks are and what to look out for. Preventing avoidable health crises is possible. Improving someone's quality of life is possible. It all starts with 3 key steps: observe, decide, act. Thanks for watching, and more importantly, thank you for all the care and support you give every day to those who need it most.